know the way I lose collagen in my face, Dr. Nama, and I need Morpheus8 treatments in my face. What about down there? I'm Dr. Ghazala Aziz-Scott. I'm the clinical director and lead doctor at the Marion Gluck Clinic, which is the UK's largest bioidentical hormone clinic. The wonderful thing about the treatments that are on offer with Sarah are that they are relatively non-invasive. There's no downtime. You come in, you have some local anaesthetic cream, you don't have to go to hospital, you don't have an anaesthetic. It's all easy to do, and it's non-interventional in the way that compared to what people had to go through in the past.
Yeah. My patients, when they come to see me, they've often already used topical estrogen creams, but they still have vaginal atrophy and they still have vulval atrophy, and they still find that their skin is getting thinner and painful.
I think it's useful for us to understand that the hormone treatments tackle just the superficial epithelium of the vagina, whereas there is a deeper dermal layer of the vaginal tissues that has fibroblasts that produce collagen. Between myself and Sarah, we can offer so many solutions. So we can offer all the vaginal estrogen creams, DHEA pessaries. We can offer the hormonal side of your intimate health, but Sarah can take it to the next level.
The medication side is really important because it's synergistic, and we need that element. But what most women aren't aware of is that you often will need an extra layer of treatment, which is where the Empower treatments come in that I offer. For you, Ghazala, we did the Morpheus8V, which is RF in combination with microneedling. Only doctors and nurses can do this treatment. Most of the people who have been trained by me or Mr. Nama, because we want to set the standard of how this machine is used.
Sure.
We don't want you uncomfortable. We've got various different numbing agents that we can use to make sure that you are relaxed and comfortable and that you can get through the treatment. But in all honesty, it's not that bad. I've had it done as well. It's not that bad, is it?
Not that bad at all. It wasn't uncomfortable. Even after the procedure, I found that within 24 hours I was pretty back to normal again. And Sarah did before and after images, and it was really interesting to see even immediately after there was an increased blood flow to the area. The tissues immediately looked healthier, and after the third treatment I could see that there had been a significant improvement. I always refer my patients to the best people in the field, and I think Sarah is totally one of the best people in this field, so I'm very confident about referring my patients to Sarah. I was even before I've had the treatment, but now I've had the treatment, I'm even more confident because you're in good hands. She's a very lovely, calm, gentle doctor in the way she approaches you. She understands that it's an intimate area. You need to be gentle. You need to preserve people's modesty, and she does all of those things. And I couldn't recommend anyone more highly in terms of this procedure. With using the hormone treatments and with using the treatments that Sarah can offer, you can actually treat the root cause of these problems.